Cindy is a person who easily affected by others. In secondary school, she gets to know Moon, a girl who started smoking since 14 years old. One day, Moon invites Cindy to try to smoke together. Hey Cindy, let us try to smoke. You will be addicted with this feeling. It is a well trying in your school life.
No, I don't want to try it.
So timing. After Cindy refused Moon's invitation of smoking, Moon feels angry. However, Moon did not give up. She always incited Cindy to smoke. Cindy, let's try. You will not be disappointed after you try smoking. Then you will feel relaxed when you are smoking. It is a good option to help you to relax. Moon invites Cindy again and again. At that time, Cindy has a lot of stress on studies. She starts to curious about smoking.
Does smoking really can help me to reduce my stress?
Then, Cindy starts to attempt to smoke with Moon. She is addicted with smoking after that. In Malaysia, smokers accounted for 22.8% amongst Malaysians who aged 15 years and above. There are some major reasons of smokers start smoking. The first reason is stress on studies. For example, Cindy wants to release the stress on study, so she starts smoking with Moon. The second reason of smoking is curiosity. The people always curious about the feeling of smoking, so they try to attempt to smoke. The third reason of smoking is peer pressure. Most of the teenagers try to smoke because they don't want to crowd out from their team. The next reason of smoking is modeling family's behavior. If the parents or siblings have smoking habit, it is high probability for the teenager to smoke as well. After a few years, Cindy found that her sight became blurred and her teeth became brownish.
Are you smoking? Yes, already 15 years. In fact, smoking will bring a lot of significant effect to your health. Smoking will bring the effect to central nervous system. One of the ingredients in tobacco is nicotine. Nicotine is extremely habit-forming, so people will feel difficult to quit smoking. Nicotine can impair your cognitive functioning and make you feel anxious, irritated, and depressed. It also can cause headache and sleep problems. That also bring the effect to the respiratory system. When you inhale smoke, you are taking in substance that can damage your lungs. Along with the increase of infections, people who smoke are at the high risk of chronic non-reversible lung conditions. The smoker has 20% higher probability to develop lung cancer than the non-smoker. The example of chronic non-reversible lung condition is emphysema, the destruction of the air cells in your lungs, and also chronic bronchitis, which is the permanent inflammation that affects the lining of the breathing tubes of the lungs. And last is chronic obstructive pulmonary disease (COPD), a group of lung disease. The third effect is toward cardiovascular system. Smoking will damage entire cardiovascular system. Then, nicotine causes blood vessels to tighten, which restrict the flow of blood. Over time, the ongoing narrowing, along with damage to the blood vessel, can cause peripheral artery disease. Next, smoking also raises blood pressure, weaken blood vessel walls, and increase blood clots. Together, this raises your risk of stroke. The next effect is about the integumentary system. It is including skin, hair, and nails. The more obvious signs of smoking involve skin changes. Substances in tobacco smoke actually change the structure of your skin. The high frequency of smoking will increase the risk of squamous cell carcinoma, which is a type of skin cancer. Meanwhile, smoking will also cause the increasing of hair loss, balding, and graying. Now, I will talk about the effect of smoking on digestive system. Smoking increases the risk of mouth, throat, larynx, and esophagus cancer. Smokers also have higher risk of pancreatic cancer. Even people who smoke but do not inhale face an increased risk of mouth cancer. Smoking also has an effect on insulin, making it more likely they will develop insulin resistance. That puts at increased risk of type 2 diabetes and its complications, which tend to develop at a faster rate than in people who do not smoke. The last is sexuality and reproductive system. Nicotine affects blood flow to the genital areas of both men and women. For men, this can decrease sexual performance. For women, this can result in sexual dissatisfaction by decreasing lubrication and the ability to reach orgasms. Smoking may also lower sex hormone levels in both men and women. This can possibly lead to decreased sexual desire. Secondhand smoke. Secondhand smoke is the combination of smoke from the burning end of a cigarette and the smoke breathed out by smokers. Secondhand smoke contains more than 7,000 chemicals, of which hundreds are toxic and about 70 can cause cancer. In addition, there are 37.1% of Malaysians are exposed to secondhand smoke at home. There is no risk-free level of secondhand smoke exposure. Even brief exposure can be harmful to health. The harmful effect of secondhand smoke bring to non-smoker is ear infections, respiratory symptoms like shortness of breath, and acute lower respiratory infection. Now, do you know the serious effect of smoking and secondhand smoke? So, you should quit smoking because smoking already brings a huge harmful effect to your lung.
After listening the advice of doctor, Cindy decided to quit smoking in order to keep her body healthy. From that day, Cindy tried to keep decreasing the frequency of smoking. However, she always cannot escape from the addiction of smoking. Cindy's parents see the situation of Cindy. They decide to help her to quit smoking.
Mom, Dad, quit smoking really difficult for me. How can I do?
Don't worry, we will suggest you some ways to quit smoking. The first way to quit smoking is preparing for quit day. There are two ways to quit: either quit abruptly, which is continue smoking right out until quit day and then stop. The second way is quit gradually, which is reduce cigarette intake slowly until quit day and then stop. For the preparation of quit day, smokers should throw away all cigarettes. Meanwhile, they also can plan to attend a stop smoking group and sign up before quit day. They also should ask friends and family who smoke not to smoke around them. Most of the smokers, while they start to quit smoke, most certainly will feel the urge to smoke many times during quit day, but it will pass. The following action may help to better the urge to smoke. First is delay until the craving passes. The urge to smoke often comes and goes within 3 to 5 minutes. Second is deep breath. Breathe in slowly through nose for a count of 3 and exhale through mouth for a count of 3. Visualize lungs filling with fresh air. Next is drink water sip by sip, beat the craving. Last is do something else to distract attention, such as go for a walk. Remember, the 4D can often help to move beyond the urge of smoking to light out. Next way to quit smoking is get consultation from smoking cessation clinics, and the consultation has been open to everyone for a long time. There are a total of 731 public smoking cessation clinics and 46 hospitals providing smoking cessation service in Malaysia. Moreover, public smoking cessation clinic will only cost you 1 ringgit to 5 ringgit per consultation. So, the method done by clinics or hospitals to make quit smoking is through nicotine replacing medication such as chewing gum. And the second method is behavioral therapy. It is including the counseling session provided by smoking cessation expert for smokers. All this treatment is follow a specific guidelines called the clinical practice guideline. So Cindy, are you understand the proper ways to quit smoking? After Cindy listened from her parents about the proper ways to quit smoking, she started the journey of quit smoking.
Oh yeah, finally I have successful to quit smoking.